Welcome everyone to another session of Health is the Ultimate Wealth. Thank you for joining us as always every Saturday evening between 5:30 and 6:30 p.m. I'm Dr. Roy. I am actually filling in for Dr. Alok Roy today, who is currently unavailable. I have with me Dr. Souvik Roy Choudhury. He's a senior consultant in ear, nose and throat (ENT) at Medica Super Specialty Hospital. And we're going to talk about a topic जो बहुत ही common है कलकत्ता में सब age group में, whether you're a child, whether you're an adult, whether you're middle age, vertigo. Vertigo is very, very common, but it is also very, very debilitating. Anybody who has had an episode of vertigo को पता है कि कितना खराब लगता है, how sick you feel, उल्टी लगती है, कुछ काम करने का मन नहीं लगता है, कुछ कर नहीं पाते, ड्राइविंग नहीं कर पाते, चल नहीं पाते, बैठ नहीं पाते, बिस्तर से उठ नहीं पाते. So Dr. Souvik Roy Choudhury is going to talk to us about vertigo, common things that you can do to diagnose what sort of vertigo you have, something how to prevent it, and of course how to treat vertigo, both common things you can do at home as well as when to come to the hospital. Without any further ado, I'll hand the session over to Dr. Souvik. Sir, please.
Yeah. Thank you, Dr. Abral. Hello, everyone. Such a nice topic will be discussed today in this platform. Thanks to Dr. Alok Roy and Dr. Aviral for inviting me in this August platform. And the topic today, as Dr. Aviral has already mentioned, vertigo is a real nuisance in a common life. One who is suffering, who has suffered the episode of vertigo, really have a dreaded experience, and the most common thing which encounters in one's mind whenever one suffers from vertigo is whom to seek the opinion for a vertigo illness, and what is the ultimate cure for this disease. And also the thing which keeps on crapping our mind is whether vertigo is curable, and is this a deadly disease? These are the very common questions which we as clinicians are facing in our daily hospital life. And believe me, in today's scenario, be it an urban, be it a rural life, vertigo is on the rise, might be due to more consciousness about the origin and the specificity of the diseases, might be due to the more accessibility of the clinical setups, but people are suffering. And let me tell you that definitive curative arrangement can be made for the vertigo if it can be detected at the proper time and by the proper way and by the proper clinician. So let me start with our topic today, that is vertigo. So as we have mentioned, we can give it a very good thing when your whole world turns upside down, or when your whole world turns spinning. So that is the enigma of vertigo. And let's solve some riddles, explore some means of vertigo. So let's start with our topic. I'm Dr. Souvik here. So mainly the thing which clogs our mind whenever we are having a vertigo patient at home is whom to seek the opinion for, as I've said before. Because vertigo falls under the domain of 2 to 3 streams. So basically, a multidisciplinary approach is the most accepted treatment. But the first-hand doctor with whom a patient can seek the opinion for a vertigo is a prime thing. So let us first bang on the vertigo origin. So we maintain our posture. Anybody who is standing, who is walking, who is talking, is maintaining his posture in the proper way with the help of 3 systems. One is our ear, one is our eyes, and one is the proprioception. Means the brain with the spinal cord, along with the touching of the feet with the ground, with our hands held like this, we can maintain the proper balance. So not a single thing is taking care of this balance. all these systems are working together for a normal, balanced individual. I'm talking about the balance of the person, not a mental balance, right? So these three systems are working together in conjunction for maintaining the normal balance. And a jeopardy in any of the system can definitely lead to this dreaded vertigo. One thing which is very common among the patients is that vertigo is a symptom. It is not a diagnosis. Be very specific. Vertigo is not a disease by itself. Vertigo is a sensation of self-motion of the head or body. You feel like a spinning of the head or the body without any actual movement being happening. That is what is vertigo as is nomenclature. So you are having a spinning movement. You can face a lightheadedness without actually these things been happening in the real time. So vertigo is not a disease by itself. It is a symptom which is expressing, might be due to failure of any of the systems, as we have said before, the ears, the eyes, or the general proprioception. Now, among this, the ear is having a major role, or we can say that most of the vertigos have got its origin from the ears. Also, here the central nervous system is also playing a very dominant role. But mostly, as we have seen before, or what we are experiencing in the daily life, or what our research papers are telling us, is that vertigo has its origin mostly from a disorder of the inner ear. So it is not a general imbalance or lightheadedness or faint like disorder. It is a rotation or spinning like sensation which the body is facing. Along with vertigo, two other terms are there which are used in conjunction with the vertigo. One is a disequilibrium and a presyncopal, where one can have a feeling of impending loss of consciousness. This is also a presyncopal lesion, which is very much mimicking a vertigo, or we can divide the spectrum of vertigo as a true vertigo, a disequilibrium, that is a feeling of off balance, or a presyncope, where vertigolar symptoms are associated with the impending loss of consciousness. Now, whenever a patient is feeling dizzy, we have to.
Sorry to disturb you, sir. Your this share screen has stopped.
Yeah, sir. Sure, sir. We are just getting back into it.
Perfect. Sorry to disturb, sir.
Yeah, sorry, sir. Yeah, fine, sir. We are fine, sir. So, whenever we are evaluating a dizzy patient, we have to first detect what type of dizziness is the patient having. How long does the dizziness stays? Is it continuous or it is coming in sporadic way? Is it positional? That is, the vertigo is changing, or the vertigo is precipitating with a change in posture of the head or the body. Is there any associated symptoms of the brain or ears with the vertigo? And what is the exact duration of the vertigo if it is episodic? So whenever a patient, this is not something very clinical oriented. Whenever we are experiencing vertigo in any of our family members or a close member at home also, not myself being a patient, I can judge these things, but any of the other members, we can really bang on without being panicky. Just some simple things. What is the specification of the vertigo? Whether it is postural, that is changing with or precipitating with the change of posture, or what is the duration of the vertigo? These are some basic, very basic things which we can really make out at home environment. Now, not going into the details of the anatomy of the ear, this is how a ear looks like. Ear is not only for hearing, but it is also something very intricate to maintain the balance of the ears. And some very important structures like the nerves, the semicircular canals, these are all related to the normal walking of a person. We can really walk or change our movement or really walk fast or anything like that by the help of these systems working in tandem with each other, along with the main central nervous system. Now, these causes lies within the ear. So it can be an inner ear, it can be with the semicircular canal, it can be with the nerves, it can be with the normal nucleus of the vestibule. These are very anatomical details of the inner ear where from the vertigo can arise, right? Being an ENT person, I will go for the main symptoms or the thing which can give rise to vertigo, that is the inner ear component. So what readily we can do whenever we are having vertigo at home? These are some of the very basic things which can be dealt with if we are experiencing vertigo at home. First is that we can have plenty amount of water. It has been shown in the research papers that a glass of cold water will really help us to keep dizziness at bay. It will help us to be more hydrated and can keep the dizziness at bay. Breathing, that is taking good breathing, right? It can relieve you of your dizziness by relaxing the nervous system. Some very basic exercises like turning your head slowly in a clockwise and anti-clockwise manner can soothe your vertigo-like symptoms. Also, whenever you are experiencing vertigo-like symptoms, you can really try to concentrate your mind on something else so that you can diversify yourself. A good massage might be a very easing factor. Also, some home remedies like ginger can be a curative for dizziness. It is particularly very helpful where you are experiencing dizziness-like spells while traveling, more like a motion sickness. So these are the basic things which we can try at home to avoid vertigo, or whenever we are having vertigo, these are the things which can be taken down to relieve some of the symptoms. Though whenever we are seeing that whenever the vertigo is of higher degrees, so that the patient can't even keep his or her head in the bed also, or the whole world is spinning like that, these symptoms really doesn't help, and one has to rush down to the emergency to be seen by a specific doctor. Now, assessment of any vertiginous patient, though it's very clinical, is very important. We have to get a proper history. We have to do whatever tests are readily available at the bedside, and some specific design tests for the assessing the vestibular function, as well as some imaging. As I have told before, whenever there is an onset of vertigo, some symptoms are very important, and a proper history taking is really going to solve certain mysteries regarding vertigo. So whenever we are experiencing a patient, we first have to clarify what is the onset of the symptoms, or rather we will ask the patient or the patient party or relatives to describe the symptoms, what he or she is facing. He or she is having a rotation, a spinning, or a feeling like just toppling over. Whether there is any associated symptoms like nausea, like headache, like ear symptoms. What is the time duration of the vertigo spells he or she is experiencing? And also, we have to frame the time that vertigo is resolving or fluctuating. Is it coming back in courses, or is it been continuous in nature? Because some of the symptoms are very specific. Like the most common thing is a Bppv, called benign paroxysmal positional vertigo, which is one of the commonest pattern and is usually lasts for seconds to minutes. So whenever we are elaborating our history, a duration of vertigo can help us to reach to a diagnosis before really going for an image. Associated symptoms like any deafness or any fullness in the ear, or any buzzing sound in the ear, or a headache, or any double vision, a feeling like nausea, as I've said before, these are also very crucial symptoms which can be associated. and we can delineate it a cause of vertigo arising from the ear or from the proprioception or even from the eyes. Now, the otologic symptoms which are very specific for a vertigo patient is a ear pain, a history of a ear surgery or a ear infection in the recent past, a hearing loss, a buzzing sound in the ear, or a feeling like fullness in the ear. So these are the symptoms which a patient can experience along with vertigo if the thing is arising from ear. Some neurological symptoms which are very specific to a vertigo is loss of consciousness, a fainting like attack, a visual loss or a double vision, difficulty in swallowing or a slurring of the speech. Also, a numbness of any part of the body can be associated. So what I am clarifying is that not only the vertigo is to be treated, we again at the same goal has to be very specific about the origin of the vertigo, because that is going to lead us to earlier settlement of the cause and also to solve any emergency if the patient is having. So otologic symptoms, if the vertigo is arising from the ear, the patient can have an ear pain, can have a ear fullness, can feel like a throbbing sensation, a buzzing sound in the ear. And if the symptoms are changing to a headache, a double vision, a speech slurring, a disorientation, then the causes are more related to the central nervous system. There are some basic differences which are there to differentiate between a peripheral, that is the ear cause, or a central cause of vertigo. Now, all these things are very scientific in approach, but these are at the end of the session, we can make ourselves a little clearer about whom we should go for at the onset of the vertigo. Because sometimes we get to see patients having knocked the doors of several doctors without reaching any definite diagnosis. So these are some of the things which can be really handy or help us in solving whom to go for. So a peripheral vertigo is more sudden. So any ear cause of vertigo is a sudden onset vertigo, very severe initially, and there can be associated nausea, can be associated buzzing sound. There can also be an intermittent episode, and it usually lasts from seconds to minutes or minutes to hours. Right, and also the peripheral vertigo, that is the vertigo arising from the ears, tends to precipitate more with change of the posture. So whenever we are turning our head like this, the vertigo is going to precipitate more. Whenever the vertigo is lasting from seconds to minutes or very harsh in nature or a sudden onset, then the cause is most likely originating from the ears. A central originating vertigo is very persistent, a mild vertigo going on for months might be before reaching a definitive treatment. Usually there is a very little change in vertigo component associated with head change in case of central nervous system causes. Associated neurologic symptoms are very important. As I've said before, there can be dizziness, there can be slurring of the speech, there can be blurred vision, there can be a disorientation. Auditory symptoms are not usually associated with a central nervous system causes. Some of the very common things which are in the circuit for peripheral vertigo and for central nervous system vertigo is charted out here. The most common being encountered is a postural vertigo. That is the vertigo being precipitated with a change in posture. And we call this condition as Bppv. That is benign positional paroxysmal vertigo. Vertigo coming in paroxysms, that is coming on and off. It is positional, that is changing it with change of posture, and it usually is benign, that is, it is not leading to serious health morbidities. So this is one of the most common etiology of the vertigo. It usually lasts from some seconds to minutes, and the patient is having a severe episode of vertigo with changing posture and coming to us seeking for treatment. There are some other causes of peripheral causes of vertigo as well. That is meninges. It can be a fistula. It can be a nerve involvement of the ear. Also, some central nervous system cause like a stroke, a benign stroke or called a TIA can also lead to a vertigo. There can be multiple sclerosis. There can be migraine where a headache is associated with vertigo-like symptoms. So these are all central common causes and these are all peripheral common causes which can really lead to vertigo. So Bppv, as I have said before, we will be highlighting about Bppv because Bppv is one of the most common cause of vertigo. So here what we see is that it is usually self-limiting. It resolves on its own. Whenever it starts with a general imbalance with a sense of nausea lasting usually for a minute. Usually it gets precipitated by certain head movements. Often it lasts no longer than few months. So a person can experience several episodes of small spells of vertigo lasting for a few minutes and it usually goes away even with few months. One specific testing is there called the Dix-Hallpike test, which can really be done at the bedside by a clinician, not at home. And some specific exercise has been done by the clinician called A+ maneuver can even treat this condition. Meniere's disease is a more complicated thing where there is a triad of vertigo along with hearing loss, along with a buzzing sound of the ear. So the patient here will experience three symptoms at the same time. The patient will experience a spell of vertigo, which is more prolonged in nature, so along with an associated hearing loss and a buzzing sound or tinnitus in nature. Now, usually these Meniere's have multiple attacks, whether vestibular neuronitis, which is another component of vertigo arising from the ear, and another notorious component that usually comes with a severe episode, banging on the person, but it usually single attack, right? So Meniere's is a severe form of vertigo arising from the ear, but coming in multiple attacks. Vestibular neuronitis, on the other hand, comes in a single attack, but it is more severe. Another most very common entity is a migraine associated vertigo, which falls under the central cause of vertigo. So here the patient will experience around 25% patients of migraine experience pains of vertigo with an attack of headache. Right? So patient is having a headache, but the headache here is not marked. The symptom which is more marked over here is a spell of dizziness. The duration can last for a few minutes to hours. It can even be a few seconds also. Right? Isolated vertigo without any headache is, as I have said, it is also a migraine component called a migraine equivalent. So the patient, a known patient having migraine can experience vertigo spells only, and on detailed history taking, we can really make out whether the patient is having a migraine associated vertigo or a migraine equivalent vertigo. Some bedside basic examinations to carry out is a general examination of the patient to know about the orientation of the patient, to see externally the nerves, the ears, and to check for some specific symptoms like an eye symptom called nystagmus. Some tests also need to be done at the bedside. But as I've said, these are all clinical tests to be done at the bedside by a clinician, right? Now, nystagmus is very specific of a vertigo. Whenever the patient is having nystagmus, there is a jerky movement of the eyeball. This is very specific of a peripheral vestibular disorder. That is the disorder which is originating from the ear. Usually, whenever we are encountering patients with vertigo, we will see the patient is having jerky movement of the eye on particular movement of the finger of the examiner. This horizontal movement is called a horizontal nystagmus. The patient can even have a vertical jerky movement, that is a vertical nystagmus. But vertical nystagmus is more common in case of central pathology, whereas horizontal nystagmus is more common in case of ear pathology. So the rule is, if the nystagmus is vertical, it is central, that is not coming from the ear. But whether the patient is, when the patient is having a horizontal nystagmus, we are more sure that the symptoms are coming from the ear, but also are associated CNS symptoms can be there. Now, nystagmus, why I am specifying nystagmus? Because nystagmus is a very basic test which can be done even by a general physician at the bedside to see or judge whether the vertigo is coming from the ear or from the central nervous system. Some specifically designed test for the vestibular function or the function of the inner ear, whether the inner ear is maintaining a proper balance or not, is been designed. Not going into the detail, but there are some tests called the head impulse test, called the caloric test, and also some skew deviation test, which are very specific for determining the vestibular function of a person. And we can really make out whether the inner ear is working properly to maintain a proper balance. So is also we can find out whether the central nervous system is acting against for this imbalance. As we have said before, some central vestibular disorder which can lead to vertigo is any brain tumors, a incident of stroke or a multiple sclerosis, but mostly they are mild in nature, going on for months, and there is focal neurological symptoms which can be associated with a central nervous system pathology. In case of central nervous system, we have said beforehand in our bedside test that we have to examine the ear. That requires a detailed examination of general examination, that requires an examination of the ear, that requires an examination of the vestibular function along with the nystagmus test. For the central nervous system originating vertigo, we need to examine the cranial nerves, we need to examine the fundus of the eye, and also a thorough neurological examination is mandatory to rule out any dreaded pathology. These are some of the very common etiologies which leads to vertigo. The time duration is very specific, and one can really make out in the clinic what he or she is suffering from precisely. Not precisely, tentatively I will say, other than the specific test been designed. One is Bppv, as we have said, benign paroxysmal positional vertigo, which usually lasts for a second, but always less than a minute. Then there can be migraine-like symptoms, where symptoms can go for seconds, minutes, hours, or it can go for days. But usually the patient will be having or giving us a history of a preceding headache or a migraine component. There can be menias when the patient is having an associated tinnitus or a buzzing sound of the ear along with hearing loss with associated vertigo. Then there can be stroke or a TIA or vestibular neuronitis, where the symptoms can go on for days, but there are some associated focal neurological signs associated with the stroke. Now, whenever we are having vertigo, what to do? As if the symptoms are mild, as been said before, we can try our breathing exercises, we can try to concentrate on some other things, we can try to have a glass of cold water, we can have some ginger in the mouth. But if the symptoms are going beyond hand, or if it is progressive, then what needs to be done? Yes, definitely we need to rush to the nearest healthcare facility to get the best of the healthcare management. Most of the times, vertigo gets settled with some basic medications being given at the ear itself. If emergency facility is not readily available at your nearby, then you have to go for your nearest general physician. Or if it is giving you more time, that is, if it is coming on and off, going on for quite a long time, and you can make your opinion regarding the doctor you need to take opinion for. Then first you have to consult. It's a multidisciplinary thing, as we have said. So you have to take the opinion from an ENT person, from a neurologist, and also from a physician. Combined effort from all these persons can help us to solve the puzzle of vertigo. If we are very specific, though, that is the vertigo is originating from the ear, or a neurologist is very specific that the vertigo is originating from the central nervous system itself, then other things can be ruled out. So first thing we need to reassure, as I have said, we are experiencing patients who are coming to us with a diagnosed, being self-made, that so I have got vertigo, so my disease is vertigo. No, the vertigo is not the disease. It's only a presentation, a symptom. The disease is something else. It has been shown up as vertigo. So don't you worry about it. Vertigo is going to settle down. As like headache, as like numbness, as like any other symptom, vertigo is also a symptom, and it is going to come down with intervention. Medicines are usually in the form of some vestibular sedatives, some drugs which are being given to compensate the vestibular apparatus. A good choice can be made with vestibular exercises. This is very important because vestibular rehabilitation exercises is something which has been developed in a proportionate way, been originating from quite a long time. These are called Postural Vertigo exercises. But they are wonderful tool to deal with these vertigo-like symptoms, and a good physiotherapy department or physiotherapist can really help you out of this. Surgery is also a needed choice for certain conditions. Like previously, severe Meniere's disease used to have a lot of surgery been done to control vertigo, but nowadays it is reduced to much extent because we are left with a deaf ear at the end of the surgery. So the vertigo symptoms will come down, but the patient will be left with a permanent deafness. So surgery for vertigo is required only if the incidents are not being controlled by normal conservative therapies or a vestibular rehabilitation therapy. And as I have said before, management of the underlying pathology. So if the patient is having a ear cause, we need to treat the ear cause. If the patient is having an eye cause, we need to treat the eye cause. If the patient is having a central nervous system pathology or a spinal pathology, then we need to treat the spinal pathology. So whenever the patient is having, we have to symptomatically relieve the patient. We have to find out the cause or the symptom system from where the vertigo is originating and treat accordingly. So that can lead to a permanent settlement of vertigo. And vertigo is not a dreadful disorder. We can well take care of a vertigo. Only thing is that we need to rush in without neglecting the symptoms at the earliest onset. And a proper multidisciplinary team approach by a ENT specialist, by a neurologist, by a physician, by a physiotherapist can help you out of these symptoms. It is not going to make you cripple throughout your life, nor it is going to jeopardize your life. You can lead a normal, healthy life as like any other person if you are following some simple basic treatment, some simple basic regimens. So that is my main goal of today's topic, to reach to the normal audience that vertigo is not a dreaded disease, it's a symptom of something underlying pathology, and it can be as benign as a benign paroxysmal positional vertigo. So do come to us and we are there to help you. Don't be worried. Vertigo can be treated, can well be managed. And that's it. Thank you, Dr. Aviral. So we can proceed with any other thing which can come into our mind for the time.
Thank you, sir. Thank you for an excellent talk. I think we really covered all the major causes of vertigo. If anybody in the audience has any questions, I would please advise you to place it in the chat box, and we'll immediately go ahead and ask Dr. Souvik those questions. In the meanwhile, so I guess as a layman or for the lay public, right? Understanding whether it is central, understanding whether it's peripheral, and if it's in the peripheral, is it eyes related or ear related, is really difficult. So when do you think you should tell somebody that, or would somebody think that I need to go see a eye doctor as a cause of my vertigo? You know?
Yeah, thank you, Dr. Abhidal, for specifying the thing. Really, it's very difficult for a layman to understand whether the vertigo is originating from the ears or from the central nervous system or from the eyes. So, if we are specifying certain things, we can at least try to make it out. If the person is complaining of a vertigo-like nature while taking the steps, then one should go for a ophthalmological checkup first. If the person is telling us that he or she is having a hearing loss or a buzzing sound in the ear along with vertigo, then a ENT doctor should be sought for. If the patient is having vertigo along with some neurological sign like disorientation, a slurring of the speech, or a tendency like falling down, then neurologist is the person whom to be taken the opinion for. So these are very basic things which can make a difference about the choice of the specialist who can really give help for the person. And without this thing, without being under the confusion of where from the thing is originating, we can readily go to any physician specialist for taking the opinion and for channeling us to the proper way.
Perfect, sir. Thank you. Just another question, because I'm just waiting to get some questions from our audience. So till then, one of the things that you did mention was proprioception, right? And I want to just discuss this because it's a difficult concept for our audience to usually understand proprioception. So just for the audience, proprioception is what you call body sense in medical terminology. It means how your body knows where all your hands and feet are located, even in the absence of directly looking at it. So that is what proprioception is for our audience. So I guess there are a lot of diseases like diabetes and the peripheral nervous system disorders that cause loss of proprioception. Is there any associated increase in unsteadiness, giddiness, or loss of balance with these disorders, sir?
Yeah, thank you, Aviral. This was a wonderful thing to mention about. Uh, Proprioception disturbance can be a generalized disorder, can be proprioception can lead us from a generalized disorder. Yes, a long-term diabetic can have a dizziness like spell, but as I have said, there is some basic difference between a dizziness or a vertigo, a disequilibrium, and a presynco. So more the episode of a vertigo, they are very specific for a ear or central nervous system. But a generalized disorder like diabetes or a long-term hypertension or a thyroid disorder or an anemia-like condition, they tend to make us more lightheaded like. They tend to make us more like a, uh, a dizziness, a feeling like I'm not walking in the straight line, I'm feeling like a little off-headed, but there is no true rotation of the head. So that can be because of a loss of a proprioception ability, because long-term diseases can be a major factor for the perceptive loss. So yes, definitely this can lead to some amount of vertigo in the long run.
Perfect. So just for our audience, the takeaway there are two types of questions that we as doctors will tend to ask you. One is lightheadedness, in which do you feel like you're about to faint, or like you're about to faint or you're about to fall down. That is called lightheadedness. And what we call spinning or vertigo, where we ask you, was the room spinning or did you feel like you were spinning in the room? That is vertigo. So these are very specific questions we ask you, because again, treatment is very, very important over here. So I'm a critical care doctor, medicine doctor. These are one of the first few questions we also ask patients. Did you feel like the room was spinning or you were spinning, or did you feel like you're going to fall down or become unconscious? Because The second one, what sir described as pre-syncope, that's lightheadedness or feeling like you're going to lose consciousness or behosh hone wale hain, that can very, very often be an early sign of a stroke in a bad location. So, what a lot of people might accidentally mistake as vertigo can in fact be stroke. So again, very important, if you're having sudden episodes of vertigo in a person who has never had vertigo in the past, if it lasts more than 2 to 3 minutes, I think they should immediately contact their local physician, local doctor, not only to ask for medicine, but to pick up early danger signs that maybe it's time to come to the hospital. What do you think, sir?
Yeah, exactly. I just cannot differ in my opinion with you. This is a very important topic to discuss with our senior consultant, Dr. Aviral, because whenever you are experiencing a symptom like faintness or a loss of consciousness, be specific without wasting any time. Just rush down, because with a vertigo, with an episode of spell of loss of consciousness or a feeling like loss of consciousness, can be a pre-syncope, can be an earlier symptom of stroke. You have to rush down, and you really need to seek the opinion of a critical care expert or the emergency expert to rule out whether any serious impending stroke is there or not.
Perfect. Thank you, sir. I think we have no further questions. So with that, I'd like to call the session to a close. Thank you to our audience for staying with us for the entire time and listening to us, and Dr. Souvik for providing such a good lecture on all the aspects of vertigo, how to differentiate vertigo from stroke, how to differentiate what's called peripheral vertigo or inner or ear vertigo from what's called central vertigo, which is basically involvement of the brain. And easy things that you can do to prevent vertigo, like drink lots of water. You can't prevent vertigo, but to decrease the symptoms of vertigo, like drink lots of water, exercise, stay hydrated, avoid dehydration. So, and getting a massage, I think most people are going to be very happy with that one. So with that, I'd like to thank everyone. I'd also like to thank the Medica IT team for enabling us to be able to present this session both on Zoom as well as live on Facebook. As always, we are always available. We'll be back every Saturday, 5:30 to 6:30 p.m. for Health is the Ultimate Wealth. Thank you, everyone. And I wish you a good evening. Happy 75th Independence Day weekend. And I'm sure a lot of you are about to leave for your vacations if you have not already left. Happy holidays.
Thank you.
Everyone.
Same here. Happy holidays. Thank you.
Thank you.